Urinalysis is a part of routine lab analysis. They may detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. Similarly, several symptoms related to urinalysis indicate specified disease. So, let us discuss differential diagnosis of urine problems today. Well, patient may tell you that symptoms vary from changes in urine color, to pain with urination, and to the inability to control when urinating. So the questions that you need to address are: interrogation of lower back or abdominal pain, vaginal discharge, passing stones or gravel, fever or chills, pain on urination or frequent urination, urgent need to urinate, dark or bloody urine, decreased force of urine stream, urination at night, uncontrolled urination, recent trauma to the anal region or abdomen, bruising or bleeding, pale stools, and jaundice. You can also ask if the patient has family history of kidney stones, kidney disease, recurrent urinary tract infections, bladder or prostate disease, diabetes, neurologic disease, high blood pressure, liver disease, blood disease, sickle cell disease, or anemia. Do ask about administration of medications that are antibiotics, warfarin, or urinary painkillers such as pyridium. After getting related information, do a thorough physical examination, which include following: temperature, blood pressure, pushing on your abdomen, digital rectal exam, checking limbs for swelling and reflexes, testing reflexes and movement, and thorough skin exam. So to make this easier for you, let's divide urine problems in 5 categories: blood and urine, painful urination, trouble urinating, uncontrolled urination, and frequent urination at night. Along with blood and urine, if the patient experiences dark urine, sometimes no other symptoms, sometimes painful urination, abdominal or flank pain, and changes in urinary habits. It is a typical case of hematuria. Hematuria occurs due to several reasons. Next comes painful urination. Along with that, if the patient has fever, an urgent need to urinate, frequent urination, chills, sometimes blood in urine, then patient may have cystitis, which is infection and inflammation of the bladder. If the patient has frequent urination, flank pain, fever, and chills, then they are suspected to have pyelonephritis, which is a kidney infection. If the patient has watery discharge from penis, then they are suspected to have urethritis in men. It is inflammation in the ureter resulting from infection, such as by the bacteria that cause gonorrhea. If the patient has history of passing blood or gravel in urine, severe pain radiating to groin or testicle, then they are suspected to have kidney stones. And if the patient has changes in urination with lower abdominal pain, then they are suspected to have prostatitis, which is inflammation of prostate gland. Now talking about trouble urinating, and along with if the patient has lower abdominal discomfort, history of prostate trouble, or kidney stones, sometimes occurs after taking anticholinergic medications such as Benadryl, then they are suspected to have acute urinary retention. It is inability to urinate that is mostly due to acute kidney injury. And if the patient has difficulty initiating urinating, frequent urinating, decreased force of urine, a prostate problem stream, most common in older men, then they are suspected to have urethral obstruction. It is a blockage in the tube that drains urine from the bladder, usually because of prostate problems. Next up is uncontrolled urination. If the patient has multiple pregnancies, then they are suspected to have stress incontinence, which occurs mostly in women. It is sort of leaking urine with laughing, coughing, or straining. And if the patient has low back pain, history of diabetes, stroke, or dementia, lower extremities may be weak, painful, or numb, then they are suspected to have incontinence due to neurological problems. This may occur due to involvement of nervous system. Lastly, frequent urination at night, and along with that, if the patient has need of urination that frequently wakes you up, then they might be on diuretic pills. They are also known as water pills. These pills are used to lower blood pressure and have a side effect of frequent urination. If the patient has shortness of breath and swelling of the legs, then they are suspected to have fluid retention, which is too much fluid in the body, which is sometimes results from congestive heart failure and other diseases. And if the patient has weight loss and urination during the day as well, then they are suspected to have diabetes. Diabetes is high levels of sugar in blood, and the patients with diabetes suffer from the symptom of polyuria. So that was all about the differential diagnosis of urine problems. Stay tuned to sqadia.com for more videos.